Hi, have you considered intermittent fasting to try to get pregnant? If you're preparing to conceive, taking care of your body is crucial. Specifically, let's focus on gut health and digestion so your body gets all the nutrients it needs to prepare to get pregnant. One emerging health trend that has been gaining popularity recently is intermittent fasting. And while it may sound daunting or even dangerous, intermittent fasting is actually a way of structuring your eating and resting your body and resting your digestive system. It's resting windows to help your body rest and digest food much more effectively and efficiently. And honestly, I'm not one to support trends, but there's some richness to intermittent fasting for fertility health. If used properly, it will benefit your fertility and your ability to get pregnant. So we explore in this episode the connection between fertility health, intermittent fasting, and I will provide you with practical tips on how to start working intermittent fasting and this practice into your daily routine. Please listen and consider intermittent fasting to structure your nutrition windows throughout your day. Hi, I'm Dr. Gina Terinoni, and I've helped over 2,000 couples and women get pregnant by helping them with daily strategies, herbal medicines, holistic medicine, functional medicine. And I created this channel in hopes to help you as well. So if you like what you're seeing on the channel or in this episode, definitely hit the subscribe button below. Let's get back to it. What is intermittent fasting? Or a lot of people will call it IF. Intermittent fasting, it's a dietary practice and it involves alternating periods of eating and fasting. So it's been around for centuries and has been practiced in various cultures and religions. It's not a diet, but rather a pattern of eating that involves restricting food intake for certain periods of time. And there's different types of intermittent fasting, including time-restricted eating, alternate day fasting, and prolonged fasting. Time-restricted eating is the most popular type of intermittent fasting, and it involves eating within a certain window of time, specifically between 8 to 12 hours a day. And that's what we're going to focus on, time-restricted eating, because this can benefit your fertility journey. So make sure you are giving your body a rest. And I want to make sure that your body is getting the proper amount of nutrition as well. So definitely check out my episode on fertility foods. So intermittent fasting has several benefits, including it reduces inflammation, improves digestion, it enhances sleep quality, and boosts energy levels. It can also help with weight loss, and it has been shown to improve insulin sensitivity and lowers blood sugar levels. And in terms of fertility health specifically, intermittent fasting may help improve overall reproductive health by reducing inflammation and improving hormonal balance. It's important to note that intermittent fasting may not be suitable for everyone, especially those with certain medical conditions such as eating disorders and diabetes. It's always recommended to consult with a healthcare provider before starting any new dietary practice. Okay, so how exactly does intermittent fasting support fertility health? Well, intermittent fasting has been shown to have several positive effects on fertility health, and one of the key benefits is its ability to regulate hormones. And who couldn't use that at whatever part of your life that you're in right now? Insulin resistance, a condition commonly associated with PCOS, polycystic ovary syndrome, can cause hormonal imbalances that affect fertility. Intermittent fasting has been shown to improve insulin sensitivity, which can lead to more regular menstrual cycles and improve fertility outcomes. Intermittent fasting can also promote healthy weight management, which is essential for fertility health. Being overweight or underweight can lead to hormonal imbalances, and that, of course, impacts fertility health and your ability to get pregnant. It also helps regulate weight by reducing caloric intake and promoting the body's natural fat burning mechanisms. It may seem counterintuitive that if you're underweight that you should fast. However, by allowing your body to rest in between meals and overnight, you allow your body to absorb more nutrients and put them to better use. If you overload your system if you keep feeding and keep eating throughout the day, then your body might get sluggish or tired, and then it's not properly maintaining the nutrients from the foods that you're choosing. So you continue to focus on nutrient-rich fertility foods without losing weight when it's done properly. Okay, so let's look through the practical and actionable steps to working in intermittent fasting in your daily routine. So I want to help you establish your ideal eating and resting windows and offer guidance on how to choose the right foods that will nourish your body during your eating periods. And I'll also share tips to help you stay hydrated throughout your fasting period, which is crucial to maintain your health and well-being. Additionally, I want to address some common concerns and challenges that you may face while fasting, such as managing hunger and cravings. You'll learn strategies to cope with these challenges, including how to keep yourself occupied during fasting hours, how to stay committed to your fasting plan. By the end of this episode, you will have the tools you need to start using intermittent fasting into your daily routine and make it sustainable and an effective part of your fertility health journey. Let's begin by planning your IF, or your intermittent fasting window, for each day. And this doesn't change. So for fertility purposes, choose a 12-hour window of eating and drinking. Outside of this window, you only drink plain filtered water with no flavors added at all. No mint, no cucumber water, no lemons, no teas or sweeteners, not even stevia. So because you're trying to get pregnant, I usually will say, oh, you can have like black tea or something, but because you're trying to get pregnant, I don't want you to rely on that. So you're going to focus on strictly water, and that is outside. On the inside, when you are eating, you can not have tea, but you can have flavored drinks. For example, if you choose to have food and tea, let's say from 7 a.m. to 7 p.m., if you're up earlier, drink water. So if you get up at 5 or you get up at 6, then drink plain water and drink a lot of it, because you might first, if you're used to eating breakfast at 6 or it's, whatever your window is, it might be a little bit tricky. Choose the window that fits your lifestyle best. You may want to choose 6 a.m., 6 p.m., or another variation. And if you work overnight shifts, adjust your time and your eating window for your 12-hour shift that you work, or if you're doing an 8-hour shift. I have a lot of nurses that I work with, so I totally get it. So make that work for your schedule. And it's always important to stay hydrated. For plenty of reasons, drinking half of your body weight in ounces of water is a strong guideline. For example, if you weigh 150 pounds, aim to drink 75 ounces of water each day around the clock. That does not have to be within your 12-hour fasting window. Keep a water bottle near you to remind you to drink and to help count your ounces. See, look, I have to keep one on my desk, or if I don't see it, I won't even think about drinking anything for hours. And of course, check with your doctor to determine the safest amount of water intake for you, because that can fluctuate. With time-restricted eating, cravings don't seem to be as much of an issue, but if you have a hard time in the beginning, that's perfectly fine, and it can be normal, totally normal. Aim to turn off your food brain by making that choice every day, and soon enough it becomes a regular habit. You just have to get past the first 2 days, I believe. If you have cravings after your eating window closes, drink water. And to make life a little bit easier, ask your partner to support you in following this 12-hour eating window as well. Sometimes eating late at night, a lot of times I should say, it's out of boredom. So check in with yourself and see why you're eating. Many times that alone will stop you in your tracks on the way to the kitchen. I know that I do that. Or I used to, I should say. And when I started fasting, I realized, wow. Next, let's get into specific foods and nutrients that can support your fertility health while you are practicing intermittent fasting. It's important to focus on balanced meals and snacks. And I want to provide you with some examples of nutrient-dense foods that you can work into your eating window. I also want to discuss the benefits of certain foods such as leafy greens, berries, healthy fats, all this for fertility health. For example, leafy greens are rich in folate, which is important for healthy fetal development, while berries are high in antioxidants, and that can help protect reproductive cells from damage. Let's also talk about some delicious and nutritious meal ideas such as spinach and mushroom omelets for breakfast, quinoa and vegetable stir fry for lunch, grilled salmon with roasted vegetables for dinner. These meals are not only nutritious, but also they're satisfying, and it makes it a lot easier to stick to your fasting schedule. It's important to focus on fertility foods that are loaded with healthy, organic, unprocessed proteins, fats, carbs, and when your body gets the correct amount of these nutrients, you will have less cravings cravings for snacking, and you also feel more energized, and you probably sleep better too. You may also notice, in addition to sleep, that you have maintained a clear focus throughout the day without any energy dips. It feels wonderful. So next, let's dive into how combining intermittent fasting with other fertility health practices can enhance the benefits of both. Yoga, meditation, acupuncture, all of these support fertility health, and these practices complement intermittent fasting. So these tools and practices reduce stress levels, improve circulation, balance hormones, and support overall reproductive health. You can use these practices in your daily routine to support your fertility health. By combining intermittent fasting with them, you can create a holistic approach to your fertility journey and support your body's natural ability to conceive and carry a healthy pregnancy. I often talk about the benefits of yoga for fertility health. Again, thinking stress reduction, anxiety relief, circulation improvement, and overall sense of lightness and joy. For meditation, it's one of the highlights of my day, and I hope it is for you now soon, if you're not already meditating. There's a lot of research on the benefits of meditation for stress relief, as well as cognitive improvement, and acupuncture and Chinese medicine have a plethora of fertility benefits. Notably, the high amounts of research support not only overall fertility health, but if you have PCOS or endometriosis, irregular or painful periods, the rewards are numerous due to improvements in circulation and a decrease in inflammation. Intermittent fasting can be a challenging practice, especially when combined with the goal of improving fertility health. So let's explore some of the common challenges and some obstacles that can arise during your journey. And I want to provide you with some practical strategies so you can overcome those. And one of the most common challenges when practicing intermittent fasting is the cravings. So it is important to choose nutrient-dense foods during your eating window to help you feel full and satisfied. So again, looking at fats, lean protein, complex carbohydrates, all of these help regulate blood sugar levels and reduce cravings. And some examples of fertility-friendly foods include avocado toast with eggs, with quinoa and roasted vegetable bowls, and add some sprouts in there, and sweet potatoes, black bean tacos. Also think salmon, wild-caught salmon, as well as dark leafy greens. Stress also can be a significant obstacle when trying to maintain a healthy lifestyle. So again, practicing stress-reducing techniques like meditation, yoga, deep breathing can help you manage stress and stay focused on your goals. And work in acupuncture if you have access, or check out some other videos where I teach you some acupressure points that will stimulate and help your gut health as well as your fertility health. So work this in, that'll help reduce stress and also promote overall wellness. To stay motivated on your journey, it's really important to track your progress, but I want you to celebrate your successes. So keep a food journal or use an app to track your meals and fasting periods. This can help you just kind of get started, and it helps you to stay accountable and see the progress that you're making, because it can feel a little rough the first 2 or 3 days, or not, or maybe it helps to get going right away. But celebrate milestones such as completing so many days in a row, keeping on track, and this will inspire you to continue on your path to better fertility health. By using these strategies, you can overcome common challenges and stay focused on your fertility journey towards improving health overall with using intermittent fasting. So the benefits of incorporating fasting into your fertility health routines are numerous. By regulating hormones, improving insulin sensitivity, promoting health weight management, intermittent fasting can support your overall fertility health. Additionally, the practice can reduce inflammation, improves digestion, enhances sleep quality, and boosts energy levels. It's important to remember that intermittent fasting is not a diet. Specifically, we're focused on nourishing and supporting your body. By eating balanced meals and snacks during your eating window and staying hydrated during your fasting period, you can ensure that your body is getting the nutrients that it needs to thrive. Incorporating other fertility health practices like yoga, meditation, acupuncture, all these can enhance the synergistic benefits of intermittent fasting. These practices can help manage stress, promote relaxation, and improve overall well-being. It's normal to encounter challenges and obstacles along the way, such as feeling frustration or maybe feeling a little bit down. However, with self-compassion, patience, and dedication, you can overcome these challenges, and it'll help you to stay on track towards your goal of having a healthy, happy pregnancy and baby. And by using these tips and strategies outlined here in this episode, you can nourish and support your body on your fertility health journey. Remember, again, celebrate your successes, track your progress, and most importantly, listen to your body and honor your needs. I wish you well on your fertility journey, and I hope to see you in one of our next videos. I'm Dr. Gina. Subscribe.